Hi everybody, thanks for watching our webinar. In case you don't know me, I'm Gerry Taylor and I'm the Director of Public Health and Wellbeing. And Lucy?
I'm Lucy Hubbard. I'm the Deputy Director for Public Health.
You'll recall that we gave a webinar a little while ago around coronavirus and what we needed to do as a team. And recently you will have seen quite a lot about the sort of budget position and all of that kind of thing. So we thought it was helpful to remind you in terms of where we are with COVID-19 now and what we all need to be doing. You'll be aware that the number of cases of coronavirus have dropped quite significantly since the peak in the kind of middle of April. But you'll see from the graph in the presentation that the numbers vary quite a lot in Luton, and we do have the occasional spike in the numbers of people, maybe in certain parts of the town or in certain community outbreaks. So we need to be continually vigilant and to keep up with some of the things that we've been doing all along to protect ourselves in terms of coronavirus.
Yeah, and I think some of those messages haven't changed, Gerry. So all of those things we've been hearing right from the beginning about keeping your distance, washing your hands, cleaning surfaces are still absolutely there. I think the other message that we're trying to get across to people now is as soon as you have any of the symptoms of coronavirus, no matter how mild, you get yourself tested straight away. Anybody who's got symptoms can have a test. It's really important that we get that information as soon as possible because that's how we're going to limit the spread. And then obviously if you've got symptoms or you've been in contact with somebody who's got symptoms, then you should self-isolate. And if we follow those 4 steps, then actually we'll continue with that downward trend in cases. The 2-metre stuff's been quite confusing though, hasn't it? And I know that we've spent quite a lot of time trying to explain it to people. What is the position, Gerry?
Yeah, I think it has been confusing for people, and particularly with some of the messages that have been coming out in the media. So the national and local guidance is that where possible, keep 2 meters apart. You only go for a distance that is less than 2 meters if it's not possible to maintain that 2 meters. So that might be, for example, if you were shopping and on public transport. And the guidance also says that where you can't maintain that 2 meters, it's the 1 meter plus idea. So as well as staying at least 1 meter apart, you need to think about some additional types of activity that will keep you safe. So that might be about wearing a face covering. It might be about thinking about the amount of time that you're in contact with people, but it's also about the sorts of things that are being put in workplaces, both locally and around the country, in terms of things like perspex screens. And it's about looking at all of those things in order to protect you in terms of social distancing, and also remembering to keep washing your hands regularly, including when you get home.
And particularly when you take that face covering off.
Absolutely.
The other thing there's been lots of stuff in the media about is around the tests. And I think we're all really familiar with the swab test now, and that's the test that tells you if you have the virus. And people I hope are familiar about that they can book it and have the test either sent to home or in Luton they can go to the airport to have their test done. The other one that's been in the media a lot is the antibody test, and that tells you if you've ever had the virus. And the timing of that's really important because actually those antibodies only really show about 3 weeks afterwards. And at the moment we're confident that you have antibodies for about 3 months, but we're still learning about this virus. We don't know how long people carry those antibodies for. That those antibodies are the things that protect you from getting the next infection. And we're not.
So who should be having this?
So we're not offering it to the general population at the moment. We're using health and social care staff, those people that have a lot of contact with vulnerable people, so that we can understand a little bit more about the disease and understand the transmission in those settings. It's not a test that can easily be done at home because the proper test has to be carried out by a clinician. You have to have blood taken. And I've not read great things about the home testing kits, Gerry. What do you think about them?
No, I'd agree. I haven't read anything that really confirms that they are a reliable kit to be using. And given that, you know, any test in terms of antibodies doesn't really give you any information upon which to change your behavior, then they're really not worth pursuing, I wouldn't say.
And I think that's the really important thing, isn't it, about not taking false reassurance from the antibody test. You still have to do the social distancing. You still have to wash your hands regularly, because you can still pass coronavirus on through touch, even if you've got the antibodies. And we've also spoken before on the last webinar around what the tests mean. So if we talk here about the swab tests that we currently do, if you test positive, it's really obvious, isn't it? That you have to self-isolate for 7 days and your family members for 14 days. If you test negative, it's a little bit more complicated, and particularly when we think about people coming back into work, it really depends on how well people are. So if you've got symptoms, what should you tell your line manager, and does it make a difference if you have got a positive or negative result?
So if you have symptoms, then you should tell your line manager, and you should be staying at home and self-isolating. Whether you've had a positive or negative result or not, if you have symptoms, stay at home. The issue will be the amount of time that you have to stay at home, and that will depend on the date of your positive test. If you have had a positive test, if you've had a negative test, it will depend on whether everyone else in your household is negative, and the amount of time since there was a kind of positive test within the house. If you have a negative test, it does give you the response that will give you a bit of an indication on what you should be doing. But if you're confused, make sure that you speak to your line manager, who will be able to advise. But I think we can't emphasize strongly enough that if you have symptoms, whether you've had a positive or negative test, you should be staying at home. You can get an isolation note that you can provide to your employer as proof that you need to stay off work. But in Luton Council, we'll be very much supporting people to stay at home if they have symptoms, or if they are a contact and need to stay at home for those 14 days.
And it doesn't count as part of your sickness trigger, does it? That absence,
No,
yeah.
it doesn't. You don't need to worry about that.
Yeah, because obviously for some people, they might have to self-isolate because they're positive, and then self-isolate a little while later, and so no, it doesn't count towards those triggers.
No, absolutely it doesn't. We've been working on, as part of this, we've been working on our local outbreak control plan. This was a plan that all local authorities needed to have in place by the end of June. And we've published ours on our website. You can have a look at that if you want to get some more information. Well done, Lucy, for helping us to get to that position and get a good plan published. This is a partnership plan, and really talks about how we will try and prevent outbreaks and what we need to do if we do have an outbreak. Now, we're really focusing on the prevention side of things, which is why we're very much reinforcing with everybody the actions that we need to take in terms of staying at home if we have symptoms, or if someone else in our household or contact has symptoms, and the need to access testing. Lucy, do you want to take control if we do have an outbreak?
Yeah, so we'll try and do everything we possibly can to prevent and provide lots of advice and support, both to individuals and to businesses. But the reality is that we are probably at some point going to have an outbreak. When we are aware of that outbreak, and it might be through monitoring data, or it might be through notification through the NHS Test and Trace, we will step up a response cell. And that response cell has got a whole range of action cards ready to go, so that we know what we're going to do. And we're testing that out now. I think what's really interesting about this is it brings together loads of parts of the council who already do sort of similar bits of work, but it brings them together in a way that we haven't before. So this is a proper sort of council response as well as being a wider partner response, particularly with our partners in health and police. I think the other thing that's slightly different about our plan from other people's, Gerry, is our focus on recovery as well. So we really want to make sure that we help both individuals recover from the impact of coronavirus as well as businesses, and make sure that we learn from that so that it improves in the future.
If we want to leave you with anything today, it is really around the prevention part of the plan and the work we were doing. Now, this really relies on us working with our staff and working with our communities. So please, as our staff, please follow the guidance around staying at home as much as possible, keeping apart, keep up with washing your hands, and make sure you self-isolate if you have symptoms, and make sure you have a test. This really relies on all of us working together in order to make sure that we all stay safe and our communities stay safe. Please have a look at the presentation so that you are aware of all of the guidance, and ask if you need further help in following it.